I'm working as a consultant psychiatrist in VIMHANS hospital. Today's topic of presentation is late life depression. This is the layout of the presentation. I shall be talking about the facts regarding depression, identification of depression, the etiology, what causes depression, the management and prevention. Before I begin with the presentation, I would like to put forward a quiz, and I would like the people from audience to respond in either yes or no. Depression is a normal part of aging. How many for yes and how many for no? How many for yes? Depression is a normal part of aging. No. Yes. Yes? No. The answer is depression is not a normal part of aging. It is not an inevitable part of aging. It is a disease. Some people who are elderly acquire depression, but it is not bound to happen with age. Depression is just sad thoughts. How many for yes? Yes? Yes. And the other people who are for no, what do they think? I would request everybody to come forwards. Is it possible so that I am able to interact better? Okay. So depression is just sad thoughts? Yes or no? Yes. Okay, the answer is no. Depression is a whole lot of other symptoms as well. And the questions shall be answered in detail as I move on with my presentation. You can snap out of depression if you think positively. Yes. How many for yes? Yes. And how many for no? And there are people who are just not raising their hands. So can you snap out of depression just if you think positively?
Not always. It's not so easy.
So depression is not really in your control. You can do something to make it better, but you require treatment. So depression is a disease. Just by thinking positively, you cannot really snap out of depression. You need to take treatment if you have depression. The best way to help a depressed person is to cheer him up. How many for yes? Raise your hands. How many for yes?
Partly.
The best way. I'm saying the best way. Is it the best way?
No.
No, so which is the best way? Okay, to offer treatment, to take him to a doctor. Talk therapy is same as talking to a friend. No? Okay, the answer is no, and we'll see what exactly is talk therapy or psychotherapy. Depression is a sign of weakness. No, depression is not a sign of weakness. It is a disease. There are medical tests to help diagnose depression. Yes? Yes. Okay. And the answer is there are no medical tests to diagnose depression. It's a clinical diagnosis. You talk to the person and you know that the person is feeling depressed. And how we identify depression, we'll see as I move on. Medicines have horrible side effects.
Yes.
So how many for yes?
The doctor knows better.
Yes, the doctor knows better. Medicines do have side effects. However, not all of them are horrible. Antidepressants are addicting.
Yes.
No. The answer is no. The antidepressants are not addicting. They are not sleeping medications. Talking about depression makes it worse. Yes or no?
No.
No. Talking about depression does not make it worse. If my parents have it, I will definitely have it.
No.
Okay. So let's move on.
The other way. If the child has it, parents will.
Okay.
As if parents will have it.
So what is late life? When we say late life depression, what do we mean by late life?